I'm Dr. Anthony Makhoba. I've been working in St. Francis Hospital in Zambia since 2013 as a physician, and I've recently joined the government of Uganda as a consultant physician working at Fort Portal Regional Referral Hospital. So I did a course, initially postgraduate diploma in endocrinology, and then later I was offered an MSc in endocrinology. That was under the Merck Foundation Diabetes and Hypertension Blue Point program. So I completed the 1-year postgraduate diploma and later also completed this year in January my MSc in endocrinology. The course was very rich in content. It covered the whole scope of what is in endocrinology, because in my practice I've been encountering patients with different conditions in endocrinology. So the content covered in the course was exhaustive. The faculty that guided us through the learning was also wonderful faculty. They are very experienced members of faculty, and they offered everything that we needed in that course that was covered. So they tried as much as possible to make it very practical, beyond just reading and sharing what was being taught per week, but they encouraged us to share what we've experienced as we were approaching each of the topics. So it was really rich in content, and I think it covered everything that we needed in that content of endocrinology. And then the MSc component also opened me to how to approach research, especially in the area of endocrinology. And I think it has equipped me with the necessary skills that I will use to further explore what is in that field of endocrinology. So after completing the course, even before I completed the course, I was able to see quite a number of patients, and my colleagues, the physicians that I work with here, have been referring to me patients who fall in the other categories of endocrinology, and especially thyroid disorders. So I've been able to attend to those patients in a more comprehensive approach than I would have done before. And also in the other area of osteoporosis, it's been quite interesting after doing that course. The way I've been approaching my patients, especially the elderly patients who kept coming with lots of bone complaints, bone pain here and there. Initially, I would put everything as if it's osteoarthritis of old age, degenerative joint disease. But after starting to evaluate them for osteoporosis, I found there is a significant number of patients who have osteoporosis, and I've been able to evaluate them much better, and even the approach to their care, I've improved that greatly. So the clinic is growing. I've even opened some files of some of the patients, especially for the thyroid patients. I've started filing them so that over time I'm able to contribute to the generation of local information about the thyroid disorders, because previously we would see them in and out but wouldn't document them. But now I'm able to document those patients, and after some time I hopefully will be able to have a good pool of them where we shall be able to have some good local data on the scope. So after completing this course, of course, I'm very happy that I've been able to add a specialty, a subspecialty under medicine, so I can confidently say I'm an endocrinologist, and it has changed the way I've been approaching my patients. So currently, I'm actively involved in the teaching of postgraduate students. We have a program here at St. Francis Hospital in Zambia. We have a postgraduate medical school, so in the Department of Medicine. I'm already teaching the course unit of endocrinology together with my other colleague who has been in the field for a long time. So that's some way of passing on the skills that I've acquired from this course, and something that I hope to, of course, teach better than I could have ever taught before. And that will also most likely interest my other colleagues in the field of internal medicine to be interested in endocrinology. Then on the clinical aspect, I also hope to, of course, widen the clinic of endocrinology. So we hope in the future within this hospital in Zambia, we'll have a clinic, a special clinic day for endocrinology, just like we have for diabetes. I would strongly recommend my colleagues to Merck Foundation for the support that I experienced. Without Merck Foundation, I cannot say I would have been able to do this course, because it's quite expensive and I wouldn't really afford. So Merck Foundation was very helpful in helping me to undertake this course, and I would recommend my colleagues to also apply through the Merck Foundation to be able to do this course so that we can increase the manpower of these specialties in our country. Of course, there are many others beyond endocrinology, and Merck, I think I would say we are very grateful for the opportunity that you've given unto us to have this specialty training that would otherwise not have been able to afford on our own, especially me in particular.